Good morning, everybody. Thank you for joining us today. At Rillea Technologies, our objective is to help companies safely, effectively, and efficiently manage the chemicals they use in their workplaces. Now, this morning, we're going to narrow that focus down a very specific topic, and that is disinfecting for the coronavirus, but with the same general idea. How do you safely do it? How do you ensure it's effective? And how are you efficient so you're not wasting time while doing that process? As Lisa mentioned, this is about 20 minutes. If you have questions, put them in the chat. At the end of the presentation phase, I'll go into the chat, just start back at the top and answer questions by reading the question aloud and then providing my response. I'm happy to stay on as long as there's people on asking questions, so I'm not limited from a time perspective. But when you've had your questions answered, by all means, feel free to drop off. So let's start with why we need to disinfect for the coronavirus. So the best description I've heard of what a virus is that it's a freeloading zombie. What this means is a virus is a living thing, so it is alive, but it can't survive or reproduce on its own. It needs a host. And sadly, we are now the hosts. And this virus is not only happy for each of us to be a host, it's always looking for the next host. And so that transmission of the virus from one person to another is obviously very rapid and is the cause for concern. There's a lot of work going on with the coronavirus, trying to understand how it moves around, why people are infected, why people are not. And there's new information coming out all the time. But the consensus seems to be that most transmission occurs person to person. So someone either through breathing, coughing, sneezing, puts particles of virus into the air. Those are inhaled by someone else, and now we've got that transmission. But it is possible that some of that transmission can occur indirectly. What that means is those virus particles end up on surfaces where they can survive for hours or even days. Someone comes along, touches that surface, then touches their facial area, somewhere where the virus can get into mucous membranes, and now we've got that transmission indirectly. So it is important to disinfect for the coronavirus. Now, given the fact that the coronavirus will not survive indefinitely on a surface, if you could leave an area for a week and then come back to it, you wouldn't have to worry about disinfecting. But the whole idea of opening back up is to get people back into the routine of their business, their day-to-day activities, which means we're no longer waiting a week for the virus to die out. Now, one of the things that first comes to mind is, well, I'll clean. I think that's a natural response. If something's dirty, let's clean it. But let me talk about three terms so that we're clear on what disinfecting means. So cleaning is removing visible debris, dirt, and dust. So if there's a layer of dust on something, you wipe that off either with a cloth or with some product, you're cleaning. Sanitizing is really the term used to address bacteria that cause foodborne illness. So it's very commonly used in food preparation, restaurants, etc. That's sanitizing. Disinfecting is using chemicals to kill viruses. Viruses are harder to kill than the bacteria. So when you're disinfecting, you're typically using a stronger chemical for a longer contact time, i.e. the surface that you're disinfecting is wetter, longer than when you're sanitizing. So disinfecting is not cleaning and it's not sanitizing. It is using chemicals to kill viruses. So that's really why you need to disinfect. This virus is out there. It can be transmitted from surfaces to people. So we need to kill the virus on the surfaces where there's common contact. So then if you understand why you're disinfecting, the next is what needs to be disinfected. So Ontario Public Health has provided some pretty good information, and by now many of people will have heard, these are the surfaces that need to be disinfected. So those high-touch surfaces, door handles, light switches, shared tools. They might be keyboards, it might be hand tools like a stapler, it might be a coffee pot in a kitchen area. And then common spaces. Where do you have a lot of people? Washrooms and entranceways, two that come to mind. So as you start thinking about what needs to be disinfected, these are those areas. The thing with disinfectants, I mentioned earlier, is they're used to kill viruses. The disinfectants are not harmless and can have negative side effects on the people who use them. So while they're important in the role of coronavirus, you really want to minimize their use because you don't want to be exposing people to these disinfectants if you don't have to. So to minimize the use of disinfectants, it's minimizing the people on site or areas they have access to. It's eliminating common contact points or sharing of tools. So if you've got something that two people use, can you get two of them so that everyone has their own? And the last one that we advocate is create a checklist of areas or items that you want to disinfect and the frequency of disinfection. If you don't have a checklist, you're likely to disinfect more things than you need to, more often than you need to. Or the other risk you run is not disinfecting the right things with the right frequency, and you're not eliminating the coronavirus in your workplace. We had an organization who asked us to give them a hand creating this checklist. So spent some time with them, and this is what we did and what we learned. Went to the workplace, and we gave, this is a small office, but we gave everybody Post-it notes of different colors and asked them to go out of the office and come into the office as they would on a regular work day and put that Post-it note on everything they touched. So they went through and they did that. And then we said, okay, let's repeat that for a visitor or a customer. What would they touch? And two things came out of that process. One, a significant amount of the things they touched were unique to their workspace. So they were unique to them and they weren't actually common. But there was way more things that were common surfaces than they had anticipated. What we then decided to do was, what can we eliminate? So in the bottom right, you see they had 3-hole punches and staplers in a common area. So they've moved those to their own desks. So everybody who needs one has their own 3-hole punch and their own stapler. So they're no longer sharing either that space or those tools. They had an entranceway where people could come in, and but there was nothing to restrict visitors from going from the entranceway throughout the entire office space. So they closed the door, put a half barricade across another entranceway so that people coming in would be just in a foyer area as opposed to free to walk around the facility. Once we'd done that, they created a checklist of the remaining points that had multicolored, multiple Post-its on it. And that became their checklist. The one thing that we did talk about once they had this checklist was, and they had their disinfectants and their frequency of cleaning was, don't forget you have to dispose of the disinfecting materials. So if you're wiping something down with a wipe or a rag or paper towel, what do you do with that material at the end of it? Ideally, you put it in a garbage can, a garbage bag, seal that garbage bag, and get rid of it. One of the things that is happening is that people are using wipes and then flushing those down the toilets, which is creating a secondary problem in the plumbing system. So when you're thinking about your checklist and how you want to keep your office clean, don't forget how you want people to dispose of the materials once they finish the disinfecting. So that's really the what. Create a simple process and a simple checklist so you know what to disinfect. And then now we're into the how. So here's 8 things to think about when you're selecting and using disinfectants. You've decided, I do need to disinfect, I know what to do, how do I do it? Select an approved disinfectant. Health Canada has a list of approved disinfectants that will kill the coronavirus. We have a link available. We will send you information with that link on it. These are products that have undergone testing and the government has said, yes, they will kill the coronavirus. Each one has a drug identification number or a DIN. And you can find that number on the product label along with the Government of Canada, Health Canada list. So here is an example of a product with its DIN on the Health Canada list. And here's the reference number along with the product information on the manufacturer supplied labeling. If it doesn't have a drug identification number, it may be on the US EPA list, because Canada, in an effort to get product flowing into the country, is using EPA-approved products as well. So that's a separate list, and you can look at that. If a product is not on the approved list, you don't know if it's going to kill the virus or not. So you can go through and do all your cleaning or disinfecting process, but maybe you haven't killed it. Now, some people say, well, I don't want to use a toxic product. I'd like to use something that's natural to kill the coronavirus. And I understand that approach. And in cleaning, that's sometimes a very effective approach. But remember, disinfecting is about killing the virus. It's a living thing. You require something that is strong to kill it. That's why you really want to look for those approved disinfectants. Once you've selected the disinfectant, you'll have to find and follow the manufacturer's instructions on how to apply it and how long the surface must remain wet. It takes a while for a disinfectant to eradicate the virus on a surface. The disinfectant is only working if the surface is wet. Once it's dry, the disinfectant is no longer working. So here are 3 examples of the application method and the contact time for 3 different products. So in the first case, it's a spray bottle, spray it on the surface, let it remain wet for 10 minutes, then wipe off the excess liquid. In the second case, apply to the surface with a cloth or a wipe. So you wipe it on the surface, leave the surface wet for 5 minutes at 20 degrees C, which is room temperature, and then you're fine. And in the third case, it's a towelette or a wipe, and the surfaces only need to be wet for 1 minute. So 3 different application methods, 3 different contact times. And the contact time is a function of the manufacturer's instructions. So you could have a cloth that's 10 minutes and a spray that's 1 minute, but that information would be provided by the manufacturer. The other thing you want to look at around the disinfectant is the WHMIS hazards. So how can this product be harmful to the person using it? So the Workplace Hazardous Materials Information System gives you great information on hazards. So let's look at 2 products. The one on the left has 5 different hazards. So, and the ones in red are more dangerous. So causes serious eye damage, causes severe skin burns. What this means is it can do irreversible harm to your eyes or skin. It could be harmful if swallowed. It may cause an allergic skin reaction. So this is a product you need to be careful with when you're applying it. The second product doesn't actually have any hazard statements. The manufacturer has determined that there are no hazards per the WHMIS definitions. So if I was given a choice between product 1 and product 2, I would rather use product 2. It's much safer for me as the person doing the disinfectant. Now, one of the things with WHMIS is it tends to talk about known hazards. And with chemicals, we don't always know what those hazards are and sometimes for years after the fact. So this is a study that's taken place in the United States, where they've been studying nurses for decades. And one of the things they have flagged is exposure to disinfectants and cleaning products is listed to COPD, chronic obstructive pulmonary disease. So long-term effects of disinfectant, not fully understood, but there is evidence that it can impact people over the long term from a breathing perspective, COPD. So it's a good reason to minimize their use. One question that people ask is, do I need to wear gloves while I'm disinfecting? So let's talk a little bit about gloves, coronavirus, and chemicals. So the standard advice we're all getting around the coronavirus is, wash your hands. Soap and water, sing happy birthday, whatever song kind of gets you 20 seconds of hand washing. In the absence of soap and water, use hand sanitizer. The thing is, skin is an effective barrier for the virus. The virus does not get through your skin, so you're not going to get sick because it's on your skin. And it doesn't harm your skin, so it's not damage to your skin from getting it on there. The problem is, if you have coronavirus on your hands and you touch your face, now you've transferred it to your face. But if you have coronavirus on a pair of gloves and you touch your face, you've transferred it to your face. So gloves don't necessarily solve the problem that the coronavirus creates from a hand perspective. Now, chemicals are different. Chemicals can harm the skin. So they can cause skin burns, they can cause irritation, they can cause dermatitis. They can also enter through your skin into your body. A product like phenol, which is not something you would come across from a disinfecting perspective, actually is an anesthetic, will numb your skin and then get into your bloodstream through your skin. So you don't even know it's on your skin, but it's getting into your bloodstream. So chemicals are different than the coronavirus. So gloves may be required when you're handling some of the disinfectants. And that's back to the safety data sheets, which will tell you whether you need to wear gloves while using that product. The second question that comes up is, do I need a respirator? So the use of masks has become quite common during the pandemic. Some stores, I think Costco now requires everyone to have a mask when they go into the store. The masks do provide some protection from the coronavirus, but the big thing about the mask is they protect other people from us. So that mask traps some of those particles that we're exhaling, coughing, or sneezing, and it prevents other people from catching them. So a mask is a very good thing to wear in this age of coronavirus, but it's really helping other people. In the last little while, I think everybody's come familiar with the term N95. N95 is a respirator. There is a standard for N95s. The 95 refers to the fact it protects you from 95% of the particles, and the size is 0.3 micron and larger. So it's actually a particulate respirator. Works pretty well against the coronavirus, and it does work against certain types of chemicals. So it actually does work against sodium hypochlorite or bleach. The bottom left is an air purifying respirator, which protects against chemicals. So there are two cartridges, so those two white oblongs on the sides of the mask are actually cartridges, and they're designed to filter chemicals. Different types of cartridges are used for different types of chemicals. So it's not just a case of having cartridges, you have to have the right cartridges for the chemicals that you're using. So respirators, very different than masks. Thing to keep in mind is you can often eliminate the need for a respirator if you're choosing the right products, ensuring there's adequate ventilation. So can you open windows or doors? Can you turn up flow rates on your ventilation system? So you've got that air exchange, so respirators are not required. Again, check the safety data sheet for more information on the products you select. Many of you would have heard about people getting sick from mixing chemicals, and there was a publicized case back in November of last year just outside of Boston where a worker in a Buffalo Wild Wings restaurant was killed by a toxic mix of chemicals. They had a highly acidic detergent, which they had spilt on the floor and didn't get cleaned up appropriately. And when they added sodium hypochlorite solution to that, to clean that floor area or sanitize that floor area, they created chlorine gas. And chlorine gas is the gas that was first used in the First World War. In this case, the amount of gas produced was enough to kill the employee. Now, mixing vinegar and bleach at home will also produce chlorine gas. It probably won't kill you, but it sends people to the hospital every year. And in the last few months in both Canada and the US, there has been an uptick in the number of people visiting the hospital for exposure to chemicals from mixing chemicals incorrectly. Last thing about disinfecting, you have to train your employees. If they're not, they need to be aware of the hazards of not only the coronavirus, but any hazards of the products they're using, and how do they protect themselves, and how do they protect everyone they're working with from not only the chemicals, but the coronavirus. Our advice is to just give people clear, simple instructions. What are the hazards of the disinfectant? What PPE requirements do you have in your workplace? How do you use it? So in this case, it's apply with a sprayer, wet for 10 minutes, wet with a clean cloth, and an incident response. So if something goes wrong, if I get it in my eyes, what do I do? If I inhale it, what do I do? So giving people just some pretty clear, simple instructions they can follow to do the disinfecting. I think if you take that simple information, combine it with a checklist, you've got a pretty good disinfecting strategy. So let me take a few minutes and just talk about the common types of disinfectants. I think there's currently well over 400 products on the Health Canada list, and then there's additional products on the EPA list in the US. The four common types of disinfectants, we'll talk about those and give you an example of each one. So sodium hypochlorite, which is often referred to as bleach. From a hazard perspective, it does cause eye burns and serious eye damage. So it does have, some hazards that you need to be aware of and work around. In terms of how you use it, you dilute at 1 to 45 with cold water. Don't dilute it with hot water. That reduces its effectiveness. Plus, you get that bleach smell when you add it to hot water, much reduced with cold water. It's about a 5-minute contact time, and then you need to rinse the surface thoroughly. One of the reasons you need to rinse it is because one, bleach is corrosive. So if it's a metal type surface, it can corrode that. And second is you don't want to have what happened with Buffalo Wild Wings, where somebody puts something else on that surface later on, and now you've created a mini chemical reaction. The great thing about sodium hypochlorite bleach is it's readily available. It's relatively cheap. I mean, the last few times I've been in the grocery store, you could see bleach in the grocery store. You don't actually need the DIN number for bleach. One key point to keep in mind is once you've diluted bleach, so you put it into a bottle, say a spray bottle, and you use that to spray and wipe, that diluted substance is only effective for about 24 hours. So once you've diluted it, you need to use it, and then the next day you need to create another batch. It will not remain effective if you keep it day after day after day. So 24 hours, then create a new batch. Second type of products are Quaternary Ammonium, not a term that you would probably come across. Again, there is a potential for health effects, the skin burns, the eye damage, potential damage to organs. Again, so this one is diluted with 1 to 62, and it's a 10-minute contact time, so 10 minutes on the surface. This is the most common category of disinfectants on the Health Canada list, with over 250 different products. Products that you may know or have come across are Clorox disinfecting wipes, Lysol disinfecting spray, or 3M surface disinfectant. A couple of problems with these products. First, some of them are known asthmagens, meaning they will cause or contribute to asthma, workplace asthma. The second is the application method. If you soak a cloth in a container with these disinfectants and then use that to wipe down a surface, a significant percentage of the active ingredient in the detergent may not get onto the surface. It will actually be bound to the cloth. This is unique to quaternary ammonia and cloth. So you need to be careful of how you're applying and what you're using to spread it around to ensure that you're getting the right amount of the active ingredient on the surface killing the coronavirus. A third type is hydrogen peroxide. This is an item that people are familiar with. It can be found in the drugstore as an antiseptic, usually in those little brown bottles. It's also found in certain hair care products to lighten your hair. The hazards of hydrogen peroxide are dependent on its concentration. So the antiseptic, that little bottle, is less than 3%. In this example, it's 10% as purchased. So the bottle is 10% hydrogen peroxide as you purchase this, but after dilution, it's under 1%. There's over 50 different products with hydrogen peroxide on the Health Canada list. One of the advantages of hydrogen peroxide is it breaks down to water and oxygen. So there's no harmful impact to the environment or to the surface. So you don't have to go through and do that secondary wipe because it's going to break down into products that are not harmful. And the last one is alcohol-based disinfectants. Many of you are now familiar with the alcohol-based hand sanitizers, which work by killing the virus and then quickly evaporating on your hands. So they're very effective if you don't have access to soap and water. A spray version of alcohol-based disinfectants works on the same idea: high alcohol contact with low contact time and quick evaporation. Hazard of the material is it's very flammable. So this is typically 60 to 90% alcohol. So it's very flammable. It's ready to use, so just spray on the surface, 60-second contact time. Two problems with this type of product. One, is ensuring you have the 60 seconds of contact time. Depending on the surface you're applying it on, temperature, etc., it could evaporate in less than the 60 seconds. The other one, not a product you want to use for large surface areas. Spraying large quantities of a highly flammable liquid over a large area and letting that evaporate would not be a good practice in my view because of the flammability. The other problem is there's only a couple of products on the Health Canada list of alcohol-based disinfectants, so there's not a lot of availability of this product. There is a separate list of hand sanitizers, which are approved by Health Canada, and again, they would have a DIN number, or they may have an NPN number, which is a natural product number. But that's a separate list, hand sanitizer list, from the hard surface disinfectant. So to summarize from today, the goal was to give you some guidance on disinfecting in the age of coronavirus. And I'd leave you with these 4 points to take away. So disinfecting hard surfaces is required for an effective coronavirus response. So it is part of your response. It's not the only thing you need to do, but it should be part of your response to the coronavirus. You want to minimize the use of disinfectants by creating a checklist. You know, whether you create the checklist in the manner we suggested or in a different manner, it's getting that checklist so you know what to disinfect and how frequently. Product selection, application, and contact time are critical. You know, is it an approved disinfectant? How do I apply it? And how long do I need to keep the surface wet to ensure that I've killed the coronavirus? And lastly, you want to train workers to use it safely and effectively. How do they protect themselves from any harms caused by the disinfectant to them? But equally importantly, how do they know how to effectively apply it so it does actually kill the virus? So you're really trying to do two things in that training program for workers. So that's the formal part of the presentation. I'm happy to answer questions in the chat. So if you have questions, put them in the chat and I will answer them. Can you use hand sanitizer on hard surfaces if it's anywhere from 70 to 80% alcohol based? Great question. You know, our guidance to people is to follow the directions from Health Canada. So if it's an approved hard surface disinfectant on the Health Canada list, then I would say yes. If it's not, I would look for something else. But I would also say, you know, high alcohol contact over large surface areas is probably not a good idea, regardless of whether it kills the virus or not, just because of the amount of vapor that you would create in the space. Thank you for the feedback from folks. Another question: what disinfectant product would be the most effective against coronavirus? It's a great question, and I wish I had a single knockout answer for you so that you would know exactly what to do. It's a little bit dependent on the circumstances. So the first circumstance is what's available. Part of the problem today is that not everything is available. So, you know, I might look for a hydrogen peroxide based wipe as, you know, low hazard, pretty effective, but you may not be able to get in touch with, get a hold of it. It's very hard to come across. So you may be left with bleach because that's what's available. So in general, I would pick one that has easiest application, i.e. a wipe, shortest contact time, can I find something that only requires a minute, and one that doesn't create any health hazard for the person using it. That's what I would look for, and that's why I mentioned the hydrogen peroxide wipes. If that's not available and all I can find is bleach, it's an effective disinfectant, but you've got exposure to, you know, chemicals, you got to manage that. It's got a longer wet time, and then you have to rinse the area off after you're done. So it's more work. So, you know, I think there is a little bit of you know, pros and cons to each one, but I would start today with what can I get my hands on. Thank you for your positive comments, everybody. We certainly appreciate that. And as Lisa said, if there's something we missed or something we can improve on, we're always happy to learn. So feel free to provide that feedback either in the group chat, or if you prefer a private message or follow up with afterwards, we're happy to learn and improve.